27th Degree with Chris and Nancy from 27 Degrees Consulting. So today we're really excited about this podcast. We're going to talk to you about a lot of common COVID vaccine questions that come up. But before we do, I also want to mention a couple of things. February 20th, Saturday, 10 a.m., we're going to have a podcast on mental health. It's very clear that there have been a lot of health issues that have come about with COVID, and we wanted to have a podcast to just discuss that. We'll have an expert who will be available to review that with you. I also want to mention that we're very excited to have a sponsor now. We have Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.com or call 508-678-7641 to learn more. And without further ado, Nancy.
Hi, Chris. So, Chris and I really looked forward to doing this podcast today. There was a lot of questions that we were fielding each week regarding where we are now with COVID-19, a lot of questions about the vaccinations. We had our last two guests on the podcast give a lot of information. So we thought it'd be good just to kind of take a step back and just summarize all that information that we've given out and answer a lot of questions that we've heard. And just as we're answering questions that we've already received, if you guys listening have any questions, just please send them in and we'll answer them as we receive them as well. So I'm going to kick this off, Chris, with one of the big questions that I get, and I imagine that you would get too, with the vaccination is, do I have to wear a mask after I get vaccinated?
Yeah, that's a great one. I get that. It's a really great one. So the short answer is yes, we do have to wear a mask after we get vaccinated. And there's a couple of reasons for that. Although the vaccine does help to reduce the risk of getting COVID-19, it is not 100%. Now, if you do get the infection, your infection will be much milder, and you'll have it for probably a decreased amount of time. You'll have less viral shedding, but you still could be infected for a short period of time. So yes, it is important to still wear a mask after you have the COVID-19 vaccine. And we'll probably be wearing masks until we have enough what we call herd immunity, meaning there are enough people that have been vaccinated in our society such that the virus is no longer a real threat.
Awesome. Thank you. You know, another thing that's in the news right now, every time you turn the news on, they're talking about all these different strains. Do you get any questions from your patients about that? Because we hear about the UK strain. We hear about the South Africa strain. Can you talk a little bit about that and, the concerns that your patients have?
Sure. I mean, I do get occasional questions about that. We haven't really seen those strains per se up in this area to any degree yet, so there's not a lot of questions on it, but I think it's a good thing to discuss anyway. So why do we have these strains? First of all, there's the Brazilian strain, the UK strain, the South African strain. Well, the reason we have these strains is because the virus has been allowed to multiply unchecked, meaning that we haven't really been effective in decreasing infection rate. We do that by vaccinations, and we do that by wearing masks and social distancing. And the vaccine rollout has been really slow throughout the world. Because of that, the virus has been allowed to replicate unchecked. And the virus, when it replicates, it's not as efficient as one would think. Sometimes mistakes are made in the genomic code of the virus, and that's what happens when you end up with a variant. So sometimes the virus will replicate and there will be a mistake in the genetic code, and that mistake may not be beneficial to its future replication, and that may go away. But sometimes there's an error that occurs and it's actually beneficial to the virus. The virus may now be more virulent or more easily spread. And that's why we end up with these various strains. So if we were able to vaccinate, if we're able to get herd immunity, if we did those things that we've been talking about for a while, we really wouldn't have these various strains. But we have that because we've really been so slow to get this virus under control. So you want to probably ask me next, Nancy, about the vaccines that are currently out and how they help with these variants.
That's exactly right. You did. That's a scary thing, but go ahead.
All right. So anyway, there's more data that needs to come out on this, but it looks like there is some resistance. These new virus strains have a resistance to the vaccine, but it's not complete. So if you were to be vaccinated with the 2 current vaccines that we're using in the United States, and you were to become infected with, say, the UK strain, it will still provide some protection, the vaccine that is, but not complete. Probably what will happen over time, this is going to end up being like the flu vaccine, okay? You're probably going to have a booster down the road, and the booster will contain some new information or new vaccine against these other variant strains. But it is critically important that everyone now get the vaccine that's available, because in doing that, one, you will provide protection against the current virus that is most prominent. You'll have some protection against the variant strains, it seems, but also we will be able to reduce the replication and the spread of this virus and reduce other mutant strains from developing.
And you hear too in the news, Chris, what's really important too, along with the vaccination. We're certainly stressing vaccination right now, but you still have to maintain your social distancing and your masking up and everything. And we do have a question from Carolyn out in Taunton about masks, and she's like, she's been seeing some people wear 2 masks. What's the deal with this? Do I have to double mask?
Yeah. It's Dr. Fauci discussed this recently. You don't need to wear more than 1 mask, first of all. Is it harmful to wear more than 1 mask? Let's ask that question. Probably not. It probably is safe to do so. Does it provide more protection? Possibly. Have there been studies that have really looked at this in a scientific manner? I mean, there's some data to suggest that it may be beneficial, but I think the more important thing, rather than wearing 2, 3 masks, if you want to, fine, go ahead. But the more important thing is wear your mask correctly. I still see a lot of people walking around with masks below their nose, and this virus is spread through nasal and respiratory secretions. So if you're wearing 3 masks below your nose, it doesn't really matter. It's not as good as wearing 1 mask correctly. So if you want to wear 2 masks, if you want to wear 3 masks, if you can breathe through that, then fine, feel free. There may be some extra protection, but more importantly, just wear your mask right. Wear it the right way. And then if you're doing that, you're probably doing mostly what you need to do.
So then when we talk about vaccinations, can people still get COVID after they get vaccinated?
They can. Even with the 2 current vaccines that are available, the Moderna and the Pfizer vaccine, the efficacy was 94 and 95%, meaning a small percentage of patients will get the infection after being vaccinated. So why is that? There could be a number of reasons for that. It could be that they didn't get an immunological response, and there can be a number of issues that can relate to that. Every individual responds differently to vaccines. We know that 94, 95% of patients will respond to these vaccines, but there are patients who may have a makeup such that they won't respond as well, and that's a small percentage. So I guess to answer your question, yes, you can get the virus after receiving the vaccine. However, it does seem that with both of the vaccines that are available, if you were to become infected, you would have milder disease, and you're not going to probably die from it. You're probably not going to be hospitalized from it either. Not to say that can't happen, but it would be a rare event. And more importantly, your viral load and shedding will be less, and probably the risk of you spreading the virus will be less. The length of time that you would have the disease would be less too. So I think you're going to be less symptomatic. You're going to spread less virus. You're going to probably infect less, be less infective to others. But you can, of course, get the virus, but to a much, much lesser degree. I mean, these vaccines are fabulous. I mean, if you think about the flu vaccine, it's 60, 70% effective. These are 94, 95%.
I haven't heard out there, and it's a question that I hear once in a while. with the efficacy is the one-shot vaccine that we're hearing a lot about now from Johnson and Johnson.
Right.
And they just applied, right, for the emergency use. So we're thinking when a couple of weeks, if that gets approved, that may be available. Is that kind of the timeline with that?
Yeah, I mean, they've applied for emergency approval, so it's, I think we're looking at weeks. Yes, I don't think we're looking at months. I think it's probably going to be weeks. So this is an interesting vaccine. So is it superior? No, but there's one thing about this vaccine that's great that the other two vaccines that are available don't have. And that is it's a one-shot vaccine. It's one and done. So you don't have to get one shot and then in the case of Moderna, wait 4 weeks, or in the case of Pfizer, wait 3 weeks to get your second vaccine. With Pfizer and Moderna, after you get the first vaccine, probably about 7 days out from the first vaccine, you have about 40, 45, maybe if you're lucky, 50% immunity. After the second vaccine, it's 94 to 95%. However, you have to wait 3 to 4 weeks, depending on which vaccine you get. And that limits the amount of persons who can be vaccinated, of course, too. And it requires 2 doses, which, also decreases the amount of persons who can be vaccinated. This is great because it's a one-time vaccine. You get it and you're done. Now, it's not as effective. It's probably about, I think, 70, 75%, 70%. But if you really delve down on the data, what you see, although it's less effective, the persons who do get clinical disease, who do get sick with COVID after getting this vaccination, get very mild disease. So they're not going to get the severity of the disease. They're not going to die from it, probably. They're not going to get hospitalized, most likely. And they're not going to spread it as well. There's some data that the viral shedding is much less, too. So yes, although it's not as effective, the fact that you just can get one vaccine and be done and then thus immunize more people with less doses, I think is a game changer. I think it's another tool in our toolbox, a great tool to have. It's great that we have all 3 vaccines. There'll be a 4th one coming down the road too. The more we can have, the better, because there's limitations in production to these vaccines. So this is why it's one of the reasons it's hard to get this vaccine out to the public. It's production, etc. I think the more vaccines we have, the more ability we have to get this out and get people vaccinated. So I think it's all positive.
I keep on remembering what Dr. Kojikara said when she was talking about the COVID vaccine. And it was kind of a neat perspective from her because she had gotten sick with COVID, and she was talking about how absolutely miserable and horrible it was. And then she said, any kind of side effect or hesitancy that you would have in thinking of getting the vaccine, any side effect is like 1/10, like so small compared to actually having COVID. Can we back up and talk a little bit more about what she said at one point too? You guys had raised a great question in that podcast where it doesn't seem, actually it was the podcast with Dr. Rizzo, where he was saying that it doesn't seem like we're seeing people get as sick with COVID now as we saw at the beginning. Do you want to just kind of revisit that a little bit, and not talking so much about the South African strain that we're seeing right now, but
I mean, I don't want people to have a false sense of security, feeling that this is not a serious illness. We certainly have a lot of Americans who are dying daily still from this virus. And we had actually 2 retired physicians in Fall River who died over the last couple of days.
Yeah, so
it's still killing a lot of people. Now, that being said, our understanding of how to fight this disease has improved. And I think that's what she was referring to. We're much better now at treating COVID patients than we were back in, early last year. So I think that for that reason, people probably have more survivability, but still, there's still a lot of deaths. So, we have to take this seriously still. And it's crucially important that everyone get vaccinated for that reason.
One of the things that we don't hear get talked about a lot is not so much the death statistics, but the complications that people have after they have COVID. I mean, there's a lot of people that are compromised for long term after
Yeah.
they get this disease as well.
Well, I that's a really important point. Um, people sometimes are hesitant to get the vaccine because they say, it's an untested vaccine and we don't know what the effects are down the road. So first of all,
Yeah.
I mean, it's been studied. It went through the same clinical trials that other vaccines have gone through. The approval process was expedited, but they went through very rigorous testing. What we don't know, what I'm more fearful of, is not the vaccine. I'm not fearful at all of this vaccine. I received it, I did fine, and I'm not worried about long-term effects of it. What I'm more worried about is what are the long-term effects of COVID, even in people who have mild disease. And I'm not saying this to strike fear in people. However, I think there are a lot of patients that I see who are younger who say, I'm not going to get that sick. So why am I going to get the vaccine? If I get the virus, I get the virus. Couple things there. One, it's not just about you, right? You're spreading this potentially to others, and those others may get very sick. They may die from it. But secondly, we don't know what the long-term effects of having COVID, even asymptomatic or mild disease, is, and we'll know that down the road, years down the road. We do know that people who get sick sometimes stay sick for a long time, and they have a lot of long-lasting effects from the infection. They can feel fatigue. They can have kind of cloudiness in their thinking. I've had that explained or described by many patients. Just a lot of things, loss of appetite, etc. So these are all concerns. I would personally be more concerned about the long-term effects of getting the virus, even if you are young and healthy, than the risk of a very well vetted and studied vaccine.
Excellent points, Chris. So here's another question. This is from John in Fall River. If I had COVID, do I still need to get vaccinated? What do you think about that?
So that's another great question. We get that all the time. And the answer to that is yes, you should get vaccinated. And the reason is we know that the natural immunity from the virus, or from having the virus, wanes over time. So you're probably not going to get reinfection, for a few months, but you certainly could be reinfected 6 months down the road. So it is important to be vaccinated even if you've had the virus. We know that the immunity that you will get from the vaccine it seems to be greater, and it seems to be more longer lasting too. So you're probably safe for about 3 months after you had the infection, but after about 3 months, you should consider getting vaccinated.
What about pregnant people, Chris?
Yeah, so this is really an interesting question. So there were some women who became pregnant during the studies. It wasn't studied per se, so they weren't looking actively for pregnant women to put into the study. That would have really not been an ethical thing to do, but there were women who got the vaccine and became pregnant, and they seemed to overall do well, right? What we do know is that COVID in pregnancy can be quite serious, and women who are pregnant who get COVID can have really quite poor outcomes. So you have to look at although it's not studied, and although no one's going to say, sure, it's great, go for it, I think you have to look at the risk that you are particularly in. I would say this: if you're in a situation where you are at risk of contracting the disease, you're a healthcare worker or in an environment where you come into contact with COVID and you are pregnant, you should very seriously think about getting the vaccine. Okay? But if it's going to be a very personal decision between you and your physician.
I should say too, at this time, there's some great information on the CDC website. They have a whole list of frequently asked questions with the answers. They have questions that even in this scenario, if you are pregnant, that you can talk to your health care provider about. So I'm going to pop on to a next question, and this is from Lenara. And she asks, is there any word on kids getting vaccinated, and what are the current cutoffs?
Sure. So this is a good question. When this vaccine was studied, children really weren't studied. Okay, and there's a reason for that. I mean, if you look at it, at the data, kids don't tend to get really severe disease. So it didn't really make a lot of sense to put them into a study where there might be risk from a vaccine that was in the process of being tested, right? So basically, the Pfizer vaccine was tested on 16-year-olds and above, and the Moderna vaccine was tested on 18-year-olds and above. If you are 16 years or older, you can get the Pfizer vaccine. If you are 18 years or older, you can get the Moderna vaccine. Currently, there's no recommendations for children to get it, although now there are studies being done on children age 12 and above. So there are some clinical trials that are being done so that we can sort this out. Because down the road, we probably wouldn't want to offer this to children, because we know that although they may not get serious disease, they represent about 12% of all COVID cases. And although they may have mild to no symptoms, they can spread the infection to others. So this is being studied right now. The two current vaccines are not available for children.
Cool. Chris, we just had a question come in from Janice. She asked, will Primacare be giving the vaccine to their patients?
Okay, so unfortunately we won't. You know, the vaccine, as you know, is very limited, and the state and the government has partnered with particular entities to give the vaccine out. Right now, it looks like in Massachusetts, and you can probably speak more to this, Nancy. I'll get off the hot seat for a bit, but it's Walgreens and CVS that are doing it. We're not going to be doing it at Primacare. Now, that being said, if you are a patient of Primacare, you can get the vaccine if you are 75 years or older at St. Anne's Hospital, and that is available. And you can contact your primary care provider, and they can give you that information. So St. Anne's is offering it to those who are 75 and older and are in the Steward system. But beyond that, it's CVS and Walgreens. And Nancy, I'll let you talk more about what's available, because I researched this a bit.
Yeah.
Ability to talk too. I don't want to do all the talking here.
Oh, come on. But so where do I get the vaccine and how do I get it? Now, Chris, you live in Rhode Island, I live in Massachusetts. So we'll talk specifically about these two states, and I'll start with Massachusetts. So just to go over some eligible population right now, phase one, of course, was the healthcare workers, the long-term care facilities, the first responders, caregivers, and care settings such as group homes, etc., and healthcare workers that are non-COVID facing. Now, we in Massachusetts are in our phase two. So that's individuals 75 and above. It's individuals that are 65 and have 2 or more comorbidities. It's going to be the early education, K through 12, the food and agricultural population, and individuals with 1 comorbidity and that type of priority. And then phase 3 opens up for the general population in April. And again, Rhode Island is a little bit different. Their phases, if you go on rhodeisland.gov, they have their timeline for vaccinations as well. And I don't believe Rhode Island has a mass vaccination site set up right now. They're really targeting their healthcare worker population at this point. But in February, age 75 plus, and I do believe they are starting to vaccinate age 75 plus. Towards the end of February, it's going to be age 65 to 74. And then in March, they get more into ages 60 to 64, it looks like. But let me talk a little bit about Massachusetts and how you can sign up to get vaccinated. So right now, Walgreens, they have a website that you can look at, and Taylor will post our social media manager will post on our website and all our social media all the links that you can click on to get appointments to get vaccinated. So Walgreens has a site, CVS has a site, Hannaford's is giving limited vaccinations too. And then of course, Mass has a lot of the mass vaccination sites up like Gillette and Fenway. I actually made an appointment. I went to Gillette and it was really organized. You know, you pull into parking lot 22, you walk in there, they do all their screening, you fill out online all your required information. It's a pretty simple process, not too bad. They do recognize that some people may not have access to online registrations. So there are some call centers that will be established very soon, if not up already. I was thinking of doctors when I do this podcast. I was going to call Governor Baker Dr. Baker, but he had said in his briefing yesterday, that the call center will get up and running too to help out, especially some of our aging population. But again, in Mass, you can look at those sites. We will have the links up for you to look at to help you sign up for your vaccination. So again, the process itself, when I'll talk about my Gillette experience. So when you stand in line to get vaccinated, they do go through some screening questions with you. You do get the shot pretty quickly. They're pretty good with their timing and not having you wait for long periods of time. After you get the vaccination, you're asked to wait 15 to 30 minutes, depending on if you've had allergic reactions in the past. And then you are, at the time you get your first vaccine, you are automatically scheduled for your second vaccine, so you don't have to worry about not being able to get in and get the appointment, because as you know, the timelines for Pfizer are 3 weeks and the timeline for Moderna is 4 weeks after you get your first vaccination to get revaccinated. And Chris, I think the CDC has expanded on that timeline a little bit too, right?
Yeah, I mean, they're trying to be more flexible. I mean, the studies were done 3 and 4 weeks. So if you can go by what was done in the study, that's always best, because that's where we get our data from, and we know the efficacy of the vaccine based on those studies and those timelines. But the realization is, we know that not everyone is going to be able to get that at 3 weeks and 4 weeks based on other issues that may come up. So you can get that at a later date. The closer to those dates, the better. But if you need to go 2 weeks later, that's certainly going to work, and it's fine. It's better than not getting the second dose.
So I'll tell you from personal experience. My husband's gotten both. He's a nurse. He's gotten both vaccinations. He didn't have any kind of side effect. Of course, I get my vaccination, and I'm like a big baby with the chills the next day. So can you talk a little bit about what you're seeing and what they're saying as far as side effects, and are side effects worse after the second shot versus the first shot? And what are you seeing most commonly?
Yeah, I mean, I think if you look at the studies and the side effects that persons have in the studies, is pretty much what we're seeing in the population that's being vaccinated now. It's mostly, and it's 12 to 24 hours after the administration of the vaccine, we're seeing some fatigue, some headaches, maybe some muscle aches, kind of mild symptoms that you would get if you have a flu. Now, not to say that there can't be more severe side effects, but you don't get COVID from the vaccine. It's not a live virus, so you're not going to get COVID. It's important to know that. But you might get some mild symptoms, as mentioned, and that's really your body reacting to this vaccine and producing an immune response. It's actually not a bad thing to feel those symptoms. For me, it was very comforting, because I kind of knew that, I had an immune response. My symptoms were mild. I had, some mild fatigue and headache. It was, honestly, if I wasn't really even thinking about it, I wouldn't even feel it. I would just recommend that everyone really look at real data. Look at what's out there. Look at the CDC. Look at legitimate sites. Do not get your information about side effects from this vaccine from TikTok. Okay? If you look at TikTok, if you look at these social media sites, you're going to have, you know, the occasional person, or maybe not so occasional, who gets up there and talks about this horrible side effect they had. And I'm not even sure that this stuff is legitimate. They're doing this for particular reasons to get viewership, and you know, look at the data. Don't look at these sites and get scared off. We need people to get vaccinated so we get back to normal life. Unless we have about 70% or more of our population vaccinated, we're going to be wearing masks for the rest of our life. You know, we're not going to have herd immunity. We need to have herd immunity. We need to have that so that this virus becomes a non-entity. So, you know, if you're going to make a decision not to take this vaccine, just make sure you're making an informed decision, and don't get your data from social media and TikTok, because that's not legitimate data. Get it from the CDC. Look at the studies if you want. Get your data from reasonable sources. I'll get off my soapbox now.
No, that's great. How long does vaccine last for? Like, you know, we talked about like how long are you protected after you get the vaccine?
Yeah, I don't think that it's completely known. The antibodies peak soon after the second dose, and then they fall off very slightly after 4 months. But that doesn't mean that you don't have immunity. Now, we know from other vaccines that are out there that sometimes when we test immunoglobulin levels, or we test to see if there's still reaction, we don't get great levels. But we also know that clinically, these people seem to be, in many instances, protected. So, to answer your question, this is a new vaccine. We don't really know. I suspect it's going to fall off slightly over a period of time, at least as we're talking about measurable antibodies. But that doesn't necessarily mean that there's not really immune protection still. We're going to know more as time goes on. This needs to be studied. You know, a year from now, we'll know where we stand with people who've been vaccinated now. But right now, it's too early to say. But it looks like, you know, there is some vaccination, there is a response that is probably long lasting, and slowly fades after 4 months, and it will probably decrease slightly over a period of time, and we'll have more data as time goes on.
Cool. Chris, so I know that if we're talking about numbers for vaccinations, about 32 million doses have been administering, reaching about 8% of the total US population, according to CDC. So that means that US is currently administering around 1.3 million shots a day. But can you talk a little bit about who shouldn't get the vaccine? Like, are there any, like, if you have this, or what are the absolute contraindication to getting the vaccine?
So, that's a great question. I get this asked all the time. Contrary to popular belief, there are very few people where this vaccine is contraindicated. Okay, here are the people who should not get it. If you have the first shot and you develop anaphylaxis, which is a very serious allergic reaction, which is life-threatening, you should not get the second shot. If you have an immediate allergic reaction or severe allergic reaction to any component in the vaccine, and the two components that we worry about, and these are by no means common allergies, but there's polysorbate, and then there's polyethylene glycol. Okay, if you have a known allergic reaction that is severe to those products that are in there, then you should not get the vaccine. I've never known a patient who had a known allergy to those two components. I think the more likely scenario would be someone would have the first dose, have some anaphylaxis, and then they would not get the second dose. But this is really rare. I mean, this is like a couple out of a million doses. So, you know, it's one of these things that I think gets blown up more than it is really an issue. I think the statistic I read, it was like 3 out of a million or something like that, anaphylaxis to the vaccine. So it's rare. So pretty much everyone is really available to get it unless they've had anaphylaxis or severe allergic reaction to the vaccine or something in the vaccine.
Chris, can you just let our viewers know what anaphylaxis is?
Yeah, anaphylaxis is a very serious allergic reaction, and believe me, if you have it, you know it. So it's life-threatening. You might have difficulty breathing, wheezing, You might be lightheaded. You could actually pass out. You could have swelling, fast heart rate, low blood pressure. There's a number of manifestations, a sense of impending doom, all kinds of odd things that can occur. But it's the type of thing, if you had it, you're going to be in the emergency room. You're not going to probably stay home with an anaphylactic reaction. You're going to know this is bad, and you're going to end up seeking help. It's not that common with this vaccine. We see it a lot with medications. It's not that it's unheard of. You see it with antibiotics, other medications. Antibiotics are known to have this associated with it. You've probably heard of people who have serious allergic reactions to peanuts, where they can die from it, from injecting peanuts. These are anaphylactic reactions that people are discussing when they talk about someone died of a peanut allergy, or an allergy to some other food product. That, if it's severe enough to land you in the hospital, that's likely an anaphylactic reaction that we're discussing.
And just so no one listening is starting to get nervous about the anaphylactic reaction, just to throw out some numbers for you, the Pfizer vaccine, approximately 6 cases per 1 million doses. So the occurrence of anaphylaxis is like really little, and Moderna was similar too.
Yeah. So I said 3, but really 6 per million.
Right.
All that number is. So you probably have about the same chance of winning the lottery as getting anaphylaxis from this.
I just bought some scratch tickets to my husband. You're like dashing his hopes.
And I'll also tell you that when you get the vaccine, people are prepared for these reactions. They have, where you're getting it, they're going to have, they're going to know about this potential, even though it's very rare. They'll have an EpiPen available. They know what to do. That's why we observe people after the vaccination is given. I had to wait around for 15 minutes. If someone has a history of a severe allergy, they wait around for a half hour afterwards. It's very evident within that time frame if something's going to happen.
So I want to just throw out something else too. For people that are trying to book their vaccines online, and they're getting frustrated because there's like no openings, keep on going on multiple times during the day, at night. If you wake up during the middle of the night, pop on. Every day they load up new vaccination slots, and Walgreens especially does updates their vaccination sites hourly. So just keep on trying to get registered for the vaccine. Chris, I have another question from one of our viewers for you. This is from Rhonda. And she says, can I get a different vaccine for my second shot? So if I got like Pfizer for my first, or Moderna, can I switch it up?
Right. So we would only recommend no other option. So it can be done. It hasn't really, it's being kind of studied and evaluated now. The studies were done on the Pfizer vaccine getting first and second shot, and Moderna first and second. But it is recognized that there will be situations where that will not be possible. There may not be Pfizer available in the community. Maybe it's Moderna. So yes, it would be okay to do that, but it's not what we would optimally like to see happen. The other thing, I just want to get back to the side effects again. I forgot to mention the most common side effect is just a little soreness on the arm where the injection is given. And it's really, I didn't think it was as bad as a tetanus vaccine. If you got a tetanus vaccine, that can be really sore. This was much milder. And I think that, a lot of people, the majority of people really have no side effects. So when we talk about these side effects, realize that, the bulk of patients probably really have nothing that they encounter other than a little soreness of the arm. So, there are patients who have some mild symptoms, and then you'll have the occasional patient who, may feel, even have a fever for a day or so, but this is not really what I'm seeing out in the community. Most people are saying they get it and they're feeling fine.
So we have another question coming in, and if I'm vaccinated and all my friends and family are vaccinated, can we hang out together without masks?
Okay, so that's a great question. So first of all, after you get the vaccination, you have to continue to wear a mask, as I discussed, until we have herd immunity. So I guess it depends on how well you know the people that you're going to be with. So, when I'm home with my family, I'm not wearing a mask with them because I know what we're doing. My wife and I basically go to work and home, and that's pretty much our life right now. And, our kids already also have very limited, social experiences at this time. So I would say that if you're going to do that, you have to really have a good sense of where people are, what they're being exposed to. And we don't always know that because remember, you can still get the vaccine, the infection. And even if you don't get a serious case, you can still spread the virus. So we don't want that to happen. So I would say that is preferable to wear a mask if you are with people that you do not live with. But if you are going to not wear a mask, you should really have a very good understanding of kind of what their risk is. And I will say it's almost impossible to know that. So I have case after case of patients who say, I was with my friend. I know her so well. We're together all the time. She tells me she doesn't really do anything that puts her at risk. And then the next thing you know, she has it, and then the friend has it, or vice versa. The friend she was with has it, and then the patient gets it. So I don't think we always know what people are doing and what they're, what exposure they have. So to answer your question, you're probably taking a risk.
So here's an interesting question too. Is one vaccine preferable to the other for specific patients? So if I have diabetes, should I get one vaccine versus the other?
All right, this is going to be a very long answer. And the answer is no. They're both,
those are the best answers.
They're really, really equivalent. 94, 95% efficacious. You can take either one. Take whatever is available.
So here's another question that just came in. Can you choose the vaccine you receive?
Probably not. There may be.
I can tell you when I've gone on websites to register to help my friends register for the vaccines, they kind of tell you which one you're getting. It just depends on the supply that's out there.
I haven't heard of any particular place that has, both that they're offering. Generally, they get one or the other. So, they'll get a shipment of Pfizer or they'll get a shipment of Moderna. So you get what's available. And I really think they're equivalent. I don't think it really matters, quite honestly. So, these differences between the two are kind of subtle in side effects and efficacy. So I wouldn't worry about it too much.
Yeah, I remember reading some stuff too on the new vaccines that are coming out. The Johnson & Johnson and these vaccines, if everything goes according to the timelines that we've seen with the other two vaccines that are out, the Johnson & Johnson vaccine, I think they'll have 110 million doses that they'll be able to deliver by June. And I think the Novavax is another vaccine that is going to be looking for approval soon. And if everything goes fine with them, I think they're on track for like 110 doses during the summer as well. So I'm so excited about those numbers.
Yeah, I mean, just need to have more toolbox, Basically right now, what we're finding is that there's more of a desire to get the vaccine than there's vaccine available. So the more vaccine we have available, the better. And hopefully some of those people who are on the fence also will convert and get the vaccine so that we can get herd immunity and be able to put this behind us and move on with what we need to in our society, open up our businesses, get our economy going again, and not see this death rate that we're seeing currently.
So one of our last questions is, should a patient who is diagnosed with COVID shortly after the first dose still receive the second scheduled dose?
Okay. Yeah, this does. So, keep in mind that after you get the vaccine, the first dose, you don't have great protection for a while, right? So you might get up to 40, 45, 50% protection or so after the first dose, but it's going to take a week or two, right? So in that time period, between then and the fourth week or third week, whether you're getting Pfizer or Moderna, you could become infected. And I've seen a few cases like this. What you want to do is you do want to get the second vaccine, but you want to make sure that you're not really symptomatic or significantly symptomatic. So you want to be past that quarantine period, past the point where you're actively infective. You want to make sure you have at this point only minor symptoms. If you need to put it off a couple of weeks, that's okay. You still want to get the second vaccine because you're going to have better immunity with that than with just the natural disease itself. But you might have to put it off, and that's all right.
So I'm going to put you on the spot now. Are you ready?
Yep.
Super Bowl Sunday coming up. Which
Yeah.
team are you voting for? Not voting, maybe I should say rooting.
I'm not going to say because I'll have, 50% of the people watching this will send me an email. So I'm going to just stay out of that. I'm a longstanding Patriots fan, and I'm sad that the Patriots did so poorly this year. I really do like Tom Brady. I wish he was still with us, and that's all I'll say. You can probably figure out leaning based on that. So,
and based on Super Bowl Sunday, what kind of advice or caution would you throw out there to people for this Sunday?
well, this really concerns me. After Christmas, we had this big spike. After Thanksgiving,
Right.
we had a spike. People got together, and I think there's this fatigue that's occurring with people. They're just so tired of being alone and being away from their family and their loved ones. They're kind of just wanted. They take the risk. But I think this is a time we can't really let our guard down. If you look at the Mass and Rhode Island numbers, they're looking better. There's a general concern that they're going to spike after the Super Bowl, 10 to 14 days afterwards or 1 to 2 weeks afterwards. I think you got to be careful still. We don't have a lot of people who are vaccinated. We're still at risk. I would recommend that if you're going to enjoy the Super Bowl, that, do it with people that you're with every day. So if you're with if that's your family, then do it with your family. Don't bring people into the mix that, you just don't know their status. Whoever's in your household normally, that's who you want to be with. You don't want to bring people don't have big parties. Don't bring people from the outside. It's just you're just taking a significant risk in doing that.
So Paula snuck in one last question. She got in just in time. If you had allergic reactions to other shots, not specifically vaccine, pneumonia shot, etc., I would assume the vaccine for COVID is entirely different. Am I correct?
You're correct. So if you had an allergic reaction, even a severe one to another vaccine or another medicine, it does not preclude you from getting the COVID vaccine, because this is a different chemical than the one that you reacted to. So you can definitely get the vaccine. The only contraindication would be anaphylaxis to the COVID vaccine or any component of the COVID vaccine. So if you have an allergy to penicillin or latex or Cipro, or I'm just throwing a number of things out here, you can still get the vaccine. If it was a severe allergic reaction that you had, we'd probably watch you a little bit longer. You're going to be watched a half hour rather than 15 minutes. But that's it. You don't need to do anything differently.
So, Chris, kind of closing remarks on the vaccine?
I think the general gist of everything I want to get out there is that it really does seem to be very efficacious. It works. It seems to be very safe. Really, we need people to get this so that we can move past this as a society. So I would really hope that everyone who can gets the vaccine. If you have concerns, then do some research on legitimate sources and really get a sense of what's really going on. Don't get your information from unreliable sources. And there's a lot of unreliable stuff out there. The majority of people are doing just great with this vaccine, and they're going to be protected. And that's what we need in this society. So thank you, everyone. We appreciate you hanging in with us there for the last 45 minutes. I want to once again mention that we have on February 20th, a Saturday at 10 a.m., we're going to talk about mental health. And this is really appropriate in light of everything going on. There's a lot of people who are suffering out there. We'll have a mental health expert who will be on to talk to us. And I want to thank and recognize Bay Coast Bank as our sponsor. Bay Coast is just right for all your financial needs. Visit Bay Coast Bank at baycoastbank.com or call 508-678-7641 to learn more. Thank you, everyone. Have a great day.
Bye.